average in the countries we work, somewhere between 50 and 100 out of 1,000 kids will fail to reach their 5th birthday. There's only 3 or 4 sort of major causes of this: diarrheal disease, malaria, and pneumonia. What is shocking is that all of those things can be addressed at extremely low cost. But the barrier is effectively delivering what we know works. The big challenge today is that almost every country in Africa has some kind of community health network, but they tend to be grossly underfunded, understocked, and undermanaged.
Mimi nilikuwa na ugonjwa wa malaria.
And so the challenge is, how can we reinvigorate this idea of door-to-door health care, make it both more impactful and financially viable in places where financial resources are extremely limited? I'm thinking about that and I go, wait a minute, hold the phone. Isn't there a business model that excels at that? And you start to think about Amway and Avon and Tupperware. Further research, I actually went out and enrolled as an Avon lady and tried to learn it from the inside. In a sense, what Living Goods does is quite simple. We recruit, train, and support networks of community health promoters who go door to door every day, teaching families how to improve their health and wealth, and then making a living by selling high-impact health products like simple treatments for malaria and diarrhea, healthy fortified foods, high-efficiency cook stoves, solar lights, and water filters.
Kodi! Sweetie, nkuchalireko bankuyiteko wizi. Je baleko mukwano. Wanju sweetie. Jango mpe kuhaga.
Most of the health centers are very far. And these mothers, these fathers do not have access to these health centers.
Oyisewe dakika ngana oba 5. Olyoka okimwe nga tagenda kuddamu kulya kintu kirala kyonna. Olyoka okimwe.
But with the Living Goods, we are always there for them. Anytime they come across you, you are ready, you have the medication, you give the treatment.
Story maro yita ne lu thena bo matia hu ko taw ni de ye de de da sin ne phyaw lai me so ni ta hu aw ma ne de thai ni mo li ya ta a be no ai do di ma.
Every agent works as an entrepreneur under the Living Goods brand. We typically partner very closely with a local government. So where we operate, we are the government's community health army. And now, perhaps most importantly, they get a smartphone. And that smartphone has a Living Goods designed application on it that can help them with a guided diagnosis of childhood diseases, that enables them to register and support pregnant women, and reminds them to follow up with those customers.
Baby wafege no muyonso omwe kubera yonke bulungi okabike nokabika empewere mekayitamwe.
It has changed the community from what it was, especially the community we have worked. It has changed the community.
Living Goods community health promoters are reducing child deaths by 25% for less than $2 a year per person. By the end of 2016, along with their partners BRAC and PSI, they will have more than 4,600 community health promoters, serving a population of more than 5 million people.
I think within 10 years' time, it's possible that every community who needs a community health worker can have one, to make sure that that kid doesn't die of malaria or pneumonia or something else ridiculously simple that they needn't die of. And I think anyone who's a parent or a human can understand that.